ahead and.
Great, thank you so much, Pamela. So my name is Katie with Int Credit Union, and just want to share a little bit with you about our credit union. So founded in 1957, INT is a not-for-profit community chartered credit union with a mission to improve our members' financial quality of life. We have more than 45 service centers located conveniently across the Front Range, and there are still more to come. We're really proud to offer better rates and lower fees through our amazing products and services to our ever-growing membership. And INT is insured by the NCUA and is an equal housing opportunity and equal opportunity lender. We're also just so incredibly grateful for our partnership with the Agency on Aging, and we have an exciting opportunity for anyone on the call this afternoon. So after today's session, you will receive a survey to complete, and if you submit that survey, then you'll be entered to win a $50 Amazon gift card. So keep an eye out for that, and thank you again to Pamela, and thanks to all of you for joining us this afternoon.
All right, very good. Keep that in mind, folks. It's a really cool thing to get this card, this Amazon card. So we really appreciate Ents offering that for us again this year. So what I'd like to do is go ahead and introduce our speaker for this evening, Roma Costanza. We are privileged to have her again with us this year. You may recall that she works in the SHIP department, which is the state health insurance program that provides free and unbiased information for all things Medicare. Roma has been providing SHIP counseling for 22 years, both at the Senior Insurance Assistance Agency, which was at one time located in the Senior Center complex, and she has been working with the Area Agency on Aging for many years. Her expertise stretches far and wide, as you will come to find, as she presents on all topics of Medicare. She stands out as the state guru and the SHIP coordinator, of this region. And this region happens to include 9 counties. She is truly the Medicare subject matter expert and trainer for all of the Colorado SHIP counselors for the state of Colorado. Please join me in welcoming Roma Costanza. Roma, it's all yours.
Thanks, Pamela. Good afternoon, everybody. And thank you for joining us for our Medicare 101 presentation, or Medicare Who Me. We are, like Pamela mentioned, going to cover a lot of information today. And so I'm going to try and get through it as quickly as possible. If you do have questions, please type them into the chat box. I will pause once or twice during the presentation to see if there are live questions anybody would like to ask by simply unmuting themselves. But again, if you have a question, it'd be easier to type it in the chat box and I can address them as they come. As best I can. Hopefully everybody got the email that I sent out shortly before this presentation, about 45 minutes ago, I think, that included many of the handouts for tonight's presentation so that you had them available to follow along with. And I think with that, we will go ahead and get started. So as Pamela mentioned, I am the coordinator for our SHIP region for the SHIP program, which stands for State Health Assistance or State Health Insurance Assistance Program. This is a federally funded program that's designed to provide free and unbiased, in-depth one-on-one counseling and assistance to all people with Medicare of all ages on all subjects of Medicare. We also, as Pamela mentioned, serve a total of 9 counties in Colorado. They are listed on the slide. Every county in every state has access to a SHIP office, if nothing else by toll-free statewide number. And I have listed the Colorado's toll-free number on the slide, as well as our local Colorado Springs office number. By calling the toll-free statewide number and telling that system what county you're calling from, it will route you to the SHIP office closest to where you are calling from. Tonight, we are going to talk about all things Medicare. So we are going to briefly cover all the parts of Medicare, including Medicare Part A for hospitalization, Medicare Part B for All outpatient services, we're going to talk about Medicare Part D, the prescription drug benefit, and we are going to talk about the differences between Advantage plans and Medicare Supplements or Medigaps. But we are going to start by who runs Medicare. It is Social Security, the Social Security Administration, that determines who's eligible for Medicare. They keep track of who's eligible. You actually contact Social Security directly to enroll in Medicare, and Social Security provides the Medicare ID card once you are enrolled. Once you are enrolled in Medicare, Social Security wants nothing to do with Medicare. So they will determine your eligibility, they will enroll you, and they will provide you with your ID card. But once you're enrolled in Medicare, if you have any questions regarding your benefits, coverages, etc., you would contact the Centers for Medicare and Medicaid Services. The Social Security Administration is available locally, and I have provided the nationwide 800 number for Social Security as well as their website and the local Colorado Springs office. Medicare, or the Centers for Medicare and Medicaid Services, which I simply refer to as Medicare, does not have a brick and mortar location. The only way to contact Medicare directly is by their toll-free number, 1-800-MEDICARE, which I've listed on the slide. Once you're enrolled in Medicare, Medicare is the entity that determines benefits. They process claims, they pay the providers directly. You appeal any disagreements with them directly. They administer all parts of the program once you have Medicare. But again, to actually enroll in Medicare, you would contact Social Security. So how are you eligible for Medicare, or who can have Medicare? Medicare is available to anybody who is a US citizen who becomes age 65 or older, and that is based on contributing into our employment income tax system or railroad retirement system. You can also have Medicare at any age if you have been determined to be disabled by Social Security, or if you are diagnosed with kidney failure and stage renal disease, or if you're diagnosed with Lou Gehrig's disease, also known as ALS. And any lawfully admitted resident alien who's resided in this country for at least 5 consecutive years is eligible to purchase Medicare. There are specific times that you would want to enroll in Medicare that you need to be aware of that you're allowed to enroll in Medicare. And most people these days, many people are working past age 65 before they retire, and you don't have to be retired to enroll in Medicare. But there is a specific enrollment period surrounding your 65th birthday that you need to be aware of. So that enrollment period surrounding your 65th birthday or eligibility into Medicare is a 7-month window. And that 7-month window starts up to 3 months prior to the month of your 65th birthday, includes the month of your 65th birthday, and up to 3 months past the month of your 65th birthday. That is your initial enrollment opportunity to enroll in Medicare based on just turning 65, or initial eligibility if you're under 65 and on disability. Other times that you can enroll are going to be special enrollment periods. And a special enrollment period is basically going to be based on delayed enrollment into Medicare because you were still actively employed. So if when you turn 65 and become eligible based on turning 65, but you're still actively working for an employer with 20 or more employees, and you have employer health coverage through that work, you can delay enrolling in any part of Medicare based on that employment. And when that employment ends and you lose that employer health coverage, you get an extended window of 8 months to enroll in Medicare without penalty. If you don't enroll when you are first eligible at 65, if you delay enrollment, but you were not actively employed with employer group coverage, you would still be able to enroll in Medicare any year down the road during the general enrollment period. The general enrollment period is January 1st through March 31st every year. If you enroll during that time frame, typically your coverage will not begin until July 1st of that year. So there is actually an additional delay. And if you're enrolling during the general election period, because you missed your initial election and you didn't fall under a special enrollment period, you could potentially be penalized, meaning you may pay more in premiums for not having enrolled when you were first eligible. Once you're enrolled in Medicare, Medicare does encourage you to create a personalized Medicare account on the website, medicare.gov. This is not a requirement to create a Medicare account, but there could be a lot of benefit to having a personalized account on the medicare.gov website. I did include in the email I sent out earlier a handout that kind of walks you through creating that account. It's literally a 5-minute process, and you do have to have a Medicare number to do that. But by creating this account, it does give you the ability to look at any claims submitted by any providers that you've seen in real time, so that you can see what they billed Medicare and what Medicare is going to pay them. It also can hold a list of your current medications, which can be useful during the annual open enrollment period, which we'll talk about in a little while. And it does have a lot of other features and functions. It does provide electronic health records that you can allow your providers and doctors to access. So there are a lot of good things that this account can provide to you. But again, it's not a requirement that you have this account. It's just strongly encouraged by Medicare. Let me address a question real quick in the chat box. Husband is covered under my current health insurance through work, which will end this June. Is there anything special I need to provide Social Security to prove that he was covered so that he's not penalized? And the answer is yes. So if anybody delays employment or delays enrollment into Medicare because they were covered under their own or their spouse's active employer group health coverage, when that employment ends and that coverage ends, Social Security will require that you submit a form that basically proves that he had coverage from the time he became eligible for Medicare to the time he lost that coverage. That form is typically provided through an employer's HR department, and it's typically the HR department that fills it out and submits it to Social Security. However, the HR department is unable to do that for some reason. You can go to the Social Security website and search for that form, delayed enrollment form, and submit it yourself. And you just simply have to know the dates of coverage that he had that employer coverage through you. So again, you can go to the Social Security website and it can provide you more information about how to do that and the form to do that with. Or I would encourage you to talk to your HR department to see if they're familiar with that process. As long as you provide that form to Social Security, they should not indicate any penalty for his delayed enrollment into Medicare Part B. So now we're going to talk about the different parts of Medicare, starting with Medicare Part A, which is primarily going to provide inpatient hospitalization coverage. Things to take into consideration. If you are already collecting a Social Security income of any kind for any reason, when you become eligible for Medicare, Social Security will automatically try and enroll you in Medicare. And that automatic enrollment means that you should receive a Medicare card in the mail up to 3 months prior to the month you turn 65. And it would go into effect the month you turn 65. However, if you're not collecting a Social Security income of any kind when you're approaching age 65, it does become your responsibility to let Social Security know whether or not you want to enroll in Medicare. And actually, you really only have to let them know if you want to enroll in Medicare. If you are delaying enrollment into Medicare because of employer coverage, you really don't need to let them know. Because when you do stop working or lose that employer coverage, you submit that form I just mentioned, and that tells them why you delayed enrollment. But it does become your responsibility if you're not collecting an income to contact Social Security to enroll in Medicare if that's what you need to do at age 65. Again, if you are not covered under an employer group health benefit through active employment, either your own or your spouse's, and you don't enroll when you first become eligible at age 65, you would be allowed to enroll down the road during that general enrollment period. But again, you would probably end up paying more in premium because you'll be penalized for not having enrolled when you were first eligible. Under Part A, for most of us, Medicare Part A will be at no monthly cost, no monthly premium. And that is based on the fact that we have worked in our lifetime, and through that work, we paid employer tax, income tax. In order to be eligible to receive Part A at no cost to you, you would have had to have worked over the course of your entire lifetime, a total of 10 years, and paid employment taxes or income taxes for 10 years. And again, that's over the course of your entire lifetime. 10 years of work or paying in the income tax system and Social Security system is basically the what Social Security counts as quarters. You have to have 40 quarters over your lifetime of work in order to get Medicare Part A at no cost. For those people who do not have that total of 10 years worth of work and income tax, you can purchase Part A, but it's not cheap. Medicare Part A can cost upwards of $499 this year per month just for the Part A benefit. Other ways someone might be able to get Part A at no cost if they do not have their own work history of 10 years or more would potentially be through their spouse who has that work history, or even an ex-spouse, as long as you were married for 10 years or longer. If you're not sure if you have enough quarters for free Part A, you do have to contact Social Security and they will let you know. You can also create your own Social Security or your personalized Social Security account on the Social Security website. I did also include information on how to do that in the email I sent earlier. Benefits of having a personalized Social Security account on their website is you can look up that information to see how many quarters you may have if you're not sure. You can get retirement benefit estimates, you can print duplicate Medicare cards, and you can actually enroll in Medicare through that system as well. So once you have Medicare Part A, what does it cover? Medicare Part A is primarily going to cover inpatient services. And for most people, that will typically be inpatient hospitalizations. So if for some reason you have to go into the hospital as an inpatient for any reason, Medicare Part A will cover all costs of that inpatient hospital stay, except for a deductible. For 2022, the deductible for inpatient admission or inpatient stays is $1,556 per stay. Medicare covers all other expenses. So if you're in the hospital for a major surgery, it's covered minus that deductible. Medicare will cover you under that one deductible for up to 60 consecutive days. But if you're only in the hospital for 3 days or 4 days and you get out and you have more than 60 days between the time you were discharged from that inpatient stay to the next time you may be admitted to a hospital, each time you're admitted to the hospital, you will have to look at paying that deductible that second time. So that deductible is applied per inpatient admission, as long as there are 60 days or longer in between discharge and admission from the last stay. If you are for some reason in the hospital longer than 60 days, 60 consecutive days, Medicare will continue to cover the cost of that stay, but they will start applying a coinsurance. And what that means is they will continue to pay everything per day minus a coinsurance that you would have to pay. And for the next 30 days, that would be almost $400. If you're there for some reason longer than 90 consecutive days, that goes up to almost $800 starting at day 90, 91. Hopefully none of us will be subject to that kind of hospital stay, and primarily you'll have to worry about that $1,556 deductible per admission. Medicare defines a benefit period for hospital inpatient stays as a 90-day window. But again, if you have 60 days between discharge and readmission, you do start a new benefit period when you're readmitted, and they do apply a new deductible. Medicare also covers inpatient psychiatric stays, but they do put a lifetime maximum on how many days they'll pay for inpatient psychiatric hospitalization. There is no maximum for inpatient medical hospitalization. So regardless of how many times you may need to go into the hospital for medical purposes, Medicare will pay for that stay every time. Again, while you're inpatient in the hospital, the cost of all services, regardless of what those services are, but do include surgeries, medications, supplies, whatever, all of those things are covered. However, there are some things that may not be covered while you're inpatient in a hospital. Personal convenience items. Medicare will not pay for you to be in a private room unless it's deemed medically necessary and ordered by a doctor. No part of Medicare will cover any of the first 3 pints of blood you may need replaced. Does not cover private duty nursing or room sitters while you're inpatient. And it does not cover what they consider self-administered drugs. And typically self-administered drugs are something that you would have to worry about on the day of discharge. On the day of discharge, you are not considered inpatient, but if it's taking them forever to get you out of the hospital and discharge you, and in the meantime, it becomes time to take your maintenance medications, then if the nurse comes in, they hand you a couple of pills for your maintenance medications and you swallow those pills, use self-administered medications when you are not inpatient. So potentially they could bill you directly for that. Other things to be aware of are if you go into the hospital, say in an emergency, if you went to the emergency room, they decided to put you in a room for observation. What you need to be aware of is just because you've gone into a hospital room does not necessarily mean you've been admitted to the hospital. You may be under observation, which is billed under a different part of Medicare and can affect benefits at discharge. Hospitals are required to provide you written notice within 24 hours, whether or not you're admitted to the hospital or still under observation. So if you have the ability and the wherewithal to ask about that, be sure you do ask about that if you find yourself in that situation. Another benefit of Medicare Part A is skilled nursing facility stays. Typically, these are going to be stays that you experience after a hospitalization for rehab or recovery. In order for Medicare to cover a skilled facility nursing stay for rehab or recovery, Medicare does require that you were inpatient in the hospital, you're admitted to the hospital for at least 3 days or longer. If you meet that 3-day or more inpatient hospital stay, the doctor discharges you to a skilled facility for rehab or recovery. Medicare will pay 100% for that skilled facility stay for the first 20 days. If you're in the facility for longer than 20 days, Medicare will continue to pay for that rehab or recovery stay. But starting at day 21, they will start applying a daily coinsurance. Again, that means that they will continue to pay all costs for that inpatient rehab stay, except for in 2022, $194.50 per day, starting at day 21. Medicare will pay all or part of your inpatient rehab stay for a maximum of 100 days at a time. And again, this is going to be 100 consecutive days. Most rehab stays after a hospitalization are on average 4 to 6 weeks. But if for some reason you have an extended stay in that rehab facility, keep in mind that on day 101, Medicare benefits cut off. Medicare does provide you an unlimited number of these 100-day benefit periods. So if you have, say you are on a ladder cleaning the gutters and you fall off the ladder and break your leg and you have to go to the hospital, they admit you so that they can set that leg. After 3 days in the hospital, you're admitted to a skilled facility for rehab. You're in rehab for 2 weeks. You're discharged from rehab. If there are 60 days between the time you're discharged and the time you would be readmitted, you start a new benefit period when you're readmitted. But if there are less than 60 days from discharge to readmission, you go back into that skilled facility, starting where you left off when you were initially discharged. Again, Medicare will cover an unlimited amount of these benefit periods as needed, but be mindful of that 100-day limit. The last benefit typically covered under Medicare Part A are going to be home health care services and hospice services. Home health care benefits under Medicare are going to be for medically necessary services. So in order to be eligible for home health care benefits through Medicare, your need for that service does have to be certified by a doctor every 60 to 90 days. And the doctor simply tells Medicare that you still meet the medically eligible requirements for that benefit. If you meet those requirements and the doctor has ordered that service, Medicare covers 100% for that care. But again, this is going to be medically necessary care. So home health care benefit will pay for a nurse to come in and check your wound or stitches or bandages. It will pay for someone to come in and provide physical therapy and occupational therapy and stuff like that. What it does not cover are going to be like housekeeping. It's not going to help keep the house tidy. It's not going to help prepare meals. It's not going to do the grocery shopping for you. It's only going to provide medically necessary services. But if those services meet your needs, those services are covered at 100%. The hospice benefit of Medicare, or the end of life benefit, is a benefit that is designed to help someone stay as comfortable as possible at an end of life situation. So this benefit will provide any care or equipment or service to someone in their home that's going to make them as comfortable as possible at an end of life situation. Those services and benefits are covered at 100% as well. There are no limits to how long these benefits can be accessed as long as eligibility criteria continues to be met. That is Medicare Part A in a nutshell. We'll talk about Medicare Part B, and then I'll pause to see if there are any other questions. So Medicare Part B is basically going to provide all of your outpatient service coverage. Again, things to take into consideration. If you're already collecting an income from Social Security will automatically try and enroll you in Medicare Part B. They'll send you that card. Again, if you are actively employed with employer coverage or a spouse of someone actively employed, you can delay enrollment into both A and B of Medicare in favor of that active employment with employer group coverage. Once that employment ends and that health coverage ends, you get that special enrollment period where you can enroll in Medicare anytime within 8 months after that without penalty. Medicare Part B for everybody does have a monthly premium. And how much that monthly premium is can depend on how much your annual income is. So just to reiterate, you can delay enrollment into Part B if you're actively employed or covered under a spouse's active employer group health benefit. When that employment ends, you get that special enrollment period. If you don't fall under either enrolling during initial enrollment and you turn 65, you weren't actively employed with employer group coverage, you can still enroll in Medicare any year down the road during the general enrollment period, but you will typically pay more in the form of a penalty for having enrolled late. There are some situations where you would be required to enroll in both A and B of Medicare. And primarily when I say situations, I mean, there are some kinds of insurance where you have to have Medicare A and B. So for instance, if you wanted to buy a Medigap policy or Medicare Supplement, if you wanted to enroll in a Medicare Advantage plan, you have to be enrolled in both A and B of Medicare to do that. If you are retired military and you are accessing TRICARE for Life, or you have, you're eligible for TRICARE for Life. Once you become eligible for Medicare, unless you're actively employed, you do have to enroll in both A and B of Medicare, or you risk losing your TRICARE benefits altogether. TRICARE does require, if you're eligible to enroll in Medicare, you have to enroll in Medicare to use TRICARE. The only exception to that is if you're actively employed with employer coverage. If you are a veteran but not retired military and you use the VA or your primary health care, keep in mind that VA is not active employment. It is not, technically, it's not considered health insurance. I do get a lot of questions from veterans as to whether or not they would need to enroll in Medicare Part B and pay for it if they get all of their services through the VA. The answer is nobody is required to enroll in any part of Medicare. It is optional for all benefits of Medicare, but there are certainly benefits for veterans to enroll in Medicare Part B. If you are a veteran, you primarily use the VA system, which is wonderful, but there may be situations where the VA is not convenient as Medicare would be. So Medicare can act as a backup so that you do have access to coverage no matter where you're at or no matter why you need it. Medicare is good anywhere in the country for any medically necessary reason whatsoever. If you delay enrollment into Medicare Part B because of the VA, again, keep in mind, it's not active employment. If you choose to enroll in Medicare later, there will be a higher premium to pay in the form of penalty. So what does Medicare Part B cost? Well, for most people, the base premium for Medicare Part B in 2022 jumped up to $170.10 per month. If you are collecting a Social Security income, that premium will be deducted automatically from your check every month. If you're not collecting a Social Security income when you enroll in Medicare, you can arrange to have that either deducted electronically every month from your bank account, or Social Security will bill you quarterly paper bill. Either way, you still have to pay that premium one way or the other. If you opt not to be collecting Social Security and you are being billed or you're paying that premium out of your bank account, keep in mind that as soon as you do start collecting a Social Security income, they will start deducting that premium from that income and stop all other payment methods. So once they are issuing you an income, that premium will always come out of that income. The late enrollment penalty that I keep mentioning over and over, the way that penalty is calculated. So for every 12-month period that you delayed enrollment into Medicare and you weren't actively employed, Medicare is going to assess a 10% penalty. That 10% penalty will accumulate for every 12-month period you were without Medicare. And if and when you enroll in Medicare down the road, they're going to take the number of years times 10%. They're going to multiply that by whatever the premium is when you enroll. And whatever that amount comes out to from that calculation is going to be tacked on top of that premium the year you enroll forever and ever and ever every month. So once penalties are accumulated, those penalties are applied monthly forever and ever. So it is always best not to incur a penalty with Medicare for any reason if you can help it. Premiums can also be higher for some people, again, based on your annual income. Several years ago, Medicare decided to start means testing Medicare premiums. And what that basically means is that the more you make in income, the higher premium you may have to pay for Medicare Part B. There are income limit thresholds. So for anybody whose annual income as an individual, single person, is less than $91,000 for a year, you will pay that base premium of $170.10. If your income goes over $91,000 for the year in 2022, you may pay a higher premium up to $238.10 for this year. And so on and so forth. There are 6 tiers of income, and every tier you exceed, your premium goes up. And that is for individuals and for couples who file jointly. What they're going to base that on, unfortunately, is going to be the most complete IRS tax filing that they can access. And what that means is they're probably going to be accessing old information. So as right now, most people have filed or are filing taxes for 2021. The most complete IRS tax filing that the Social Security Administration can access is going to be for 2020. So if you had a significant income in 2020, you may actually get a notice in the mail from Social Security saying you have to pay a higher Part B premium based on having that higher income during that tax year. If you have a life-change event when you get that notice, such as you've had a divorce or something that has significantly changed your income, you can appeal that higher premium. And you can visit the Social Security website to download the forms and get more information. That means testing is referred to as IRMA, or Income-Related Monthly Adjustment Amount. And that would be the information you searched for on the Social Security website. Once you're enrolled in Medicare and you're paying that Part B premium, Medicare Part B services does have a annual deductible. Again, this is an annual deductible, not a per stay or per service deductible. The annual Part B deductible for this year, $223, a drop in the bucket compared to most deductibles. Once your deductible is met, then Medicare Part B typically pays for most services at an 80-20 split. So what does Part B cover? Again, Part B basically covers all your outpatient needs. So doctor's visits of any and all kinds, all your lab and x-rays. Medicare Part B covers medical, surgical, and anesthesia services, and Medicare does pay for medical second opinions. I mentioned before that no part of Medicare covers any of the first 3 pints of blood someone might need, but Medicare Part B will start covering blood at pint number 4. Part B covers all your emergency ambulance transportation, covers annual vaccines such as the flu shot, pneumonia shot, the shingles vaccine, covers all your outpatient physical, occupational, and speech therapies, covers durable medical equipment such as oxygen and wheelchairs and walkers. And there is some limited coverage for some services such as chiropractic, podiatry, optometry, and perhaps some others. So again, basically all your outpatient services. The key for Medicare to pay for any service is medical necessity. As long as the service you're receiving is medically necessary, and the doctor that you're seeing is willing to tell Medicare it was medically necessary, Medicare should pay for any medical needs you ever have. There are some things Part B does not pay for. Medicare Part B does not pay for routine physicals. So if you are used to getting a routine physical every year, that is not what Medicare covers. Medicare does not cover routine foot care, but it will cover foot care if you have a medically necessary reason you can't do your own foot care safely. And that is going to be if you are diagnosed as diabetic or have a heart condition where it's unsafe to do your own foot care. Medicare does not cover hearing aids or the fitting of them, does not cover routine eye exams or the classes associated with them. And even in medically necessary eye service visits, if a provider does a refraction of your eye where they shine the bright light and you can't see for a couple hours, that is not covered by Medicare. Currently, Medicare does not cover dental. And we'll talk about the difference here in a minute. And it does not cover anything that's considered cosmetic, meaning not medically necessary. Now, if you have an eye issue, a medical eye issue, so say you're developing cataracts or glaucoma, Medicare will pay for you to see the eye doctor. Same thing with foot care. Dental, no exceptions. Cosmetic, no exceptions. And even though Medicare does not cover routine annual physicals, Medicare does cover preventive services. When you first become enrolled in Medicare, Medicare will provide you with a benefit of the Welcome to Medicare Preventive Visit. This is a use it or lose it benefit. So once you're enrolled in Medicare Part B, you have up to 12 months to take advantage of the Welcome to Medicare Preventive Visit. Again, this is not a physical, but it is an in-depth visit with your medical provider to talk about your medical history, your social history, your family's history, and for that provider to potentially suggest or encourage you to get some other preventive services. Whether you take advantage of that Welcome to Medicare Preventive Visit or not within the first 12 months, you would still have the ability to take advantage of the annual wellness review through Medicare. Again, not a physical, but it is an annual opportunity to sit down with your provider and have an in-depth conversation about your medical history for the last year, your social history, mental health, that kind of stuff. And it does provide your provider with an opportunity to suggest future preventive services. Medicare covers a huge number of preventive services. The best way to find what services may be covered under that benefit of Medicare would be to either go to the Medicare.gov website and click on the Medicare New Handbook and download it as a PDF, or you can call 1-800-Medicare and ask them to mail you a Medicare New Handbook specific to Colorado. Once you're enrolled in Medicare for a year or two, Medicare will start mailing you this Medicare New Handbook automatically every year. But the year that you actually enroll in Medicare, you have to request one. In that Medicare New Handbook, there is about a 30-page section that details all the different preventive services that Medicare will pay for, how often you can get them, what criteria has to be met in order to be eligible for a preventive service. All preventive services described in that section are indicated by a little blue apple symbol next to that description. As of 2020, any service that Medicare covers as a preventive benefit, Medicare pays for at 100%. And then real briefly, there is some financial assistance available for people who are limited or low income and would have difficulty paying the Medicare premium. These programs are called Medicare savings programs. Again, these are programs for people with limited or low income. There are income and asset limits to qualify. There are different levels that you can qualify at. At minimum, if you qualify for this program, you could qualify for the state of Colorado to pay your Part B premium so that $170.10 is not deducted from your Social Security income. The state will pay that premium for you. If anybody wants any additional information about these programs, our office does help with applications and eligibility determination for this assistance, and we're always happy to talk to somebody about these benefits. And with that, I will take a quick pause to see if there are any questions. And it looks like there is a question in the chat box. For someone who's retired military at age 65, did I hear you say I had to sign up for A and B, even though I still have coverage through the employer? No, that is the one exception. So if you are active, if you are retired military, but you are actively employed with employer coverage, you can delay enrollment into Medicare and delay enrollment in TRICARE. As long as you're actively employed, it does not affect your TRICARE eligibility. If you were not employed, you would have to enroll in A and B or risk losing TRICARE. But as long as you are employed with employer coverage, your TRICARE is good to go. As soon as you enroll in Medicare A and B, you can access the TRICARE for Life coverage that is designed to coordinate with A and B. So as long as you're employed, you're okay. Were there any other questions? While I take this quick pause, if you did have a question, you are welcome to unmute and ask your question. All right. Well, if there are no questions, we will move on. So that was A and B coverage in a nutshell, your costs, your coverage, your benefits. Once you're enrolled in Medicare A and B, you do have a couple of choices to make. And those choices include whether or not you want to purchase additional coverage or enroll in additional coverage to go with your A and B. For most people, you have two options in that direction. You can either look at purchasing a Medigap plan, otherwise known as a Medicare supplement, or you can enroll in a Medicare Advantage plan. We're going to talk about Medicare supplements first. So a Medicare supplement or Medigap plan is a plan. It is a private insurance policy that you purchase from a private insurance company. And this policy is solely and specifically designed to supplement or pay the costs that Medicare A and B left over after they paid their part first for any medical service you needed. And that's all it does. So let me say that again. A Medicare supplement policy is a policy you purchase from a private company, and it is solely and specifically designed to pay the balance that Medicare A or Medicare B left over after they paid their part first for any medical service you need. So it is designed to pick up that hospital deductible every time you're admitted to the hospital. It is designed to pay the other 20% after Medicare pays its 80% for outpatient services. That is where the phrase Medigap comes from, because the thought process is that it's designed to cover the gaps in your Medicare benefits. So theoretically, between Medicare and a Medicare supplement or Medigap, you could have almost 100% medical coverage. Medigap policies do have to follow all federal and state laws, rules, and regulations designed to protect the consumer, you. If you purchase a Medigap policy and you get that physical policy, it must say Medicare supplement insurance on that policy, those three words in that order. And there are different levels of coverage you can choose to purchase under this kind of benefit. Typically, there are 9 levels of coverage to choose from, with the exception of the 3 states listed. They have a couple of more levels to choose from. Costs can vary from company to company for this kind of coverage and based on the level of coverage you choose. But costs can also vary by the company you choose to enroll with and where you live. Your zip code can vary based on whether you're male or female, can vary based on your age. There are a lot of factors that go into the premiums for this kind of coverage based on all of those things. This kind of insurance only works if you have original Medicare A and B. So you enrolled in A and B, you pay your Part B premium, and you enroll and purchase a Medicare supplement or Medigap policy. If you have other coverage, you may not need or be able to buy this kind of coverage. So if you are already enrolled in a Medicare Advantage plan, you cannot buy a supplement in addition to that. If you have other creditable coverage, for example, if you're retired military and access TRICARE for Life with your Medicare, or if you're a retired federal civil service or a retired public employee, para, those employers do offer very good retirement health benefits that are specifically designed to coordinate with Medicare, and you would not need to purchase any other coverage such as a Medigap policy. But without those options, and if you purchase this kind of coverage, keep in mind that Medicare is your primary coverage, and this would be your secondary or supplemental coverage to Medicare. When Medicare is your primary insurance, Medicare is good with any provider that accepts it anywhere in this country and or our territories for any medically necessary service you ever need. And as long as Medicare pays their part first, the supplement pays the balance. So this option and this combination of coverage is the most portable coverage available for Medicare, which is especially important for people who tend to travel a lot, or maybe for people who snowbird between here and another state. There are certain times that are better to buy this kind of coverage than others. Again, you do have to have both A and B of Medicare in order to purchase this kind of coverage. And when you first become enrolled in both A and B of Medicare, the government provides you with what they call a guarantee issue period into this kind of coverage. What that means is, regardless of any pre-existing health issue, if you buy this kind of coverage within 6 months of both A and B being in effect of Medicare, you are guaranteed to be able to purchase any level of coverage from any company you want with no questions asked. They have to sell you whatever you want as long as you purchase it within 6 months. If you don't purchase this kind of coverage during that 6-month guarantee issue period, you can still try and purchase this coverage at any time in the future, but you would have to worry about passing underwriting, meaning the insurance company would be allowed to look at your health history. And if they did not like what they see, they would not have to sell you insurance. There is no physical involved with buying this kind of coverage. It's simply based on looking at your health history or medical records. The 6-month window of guarantee issue is especially important if you are becoming eligible or enrolled in Medicare and you're under age 65, meaning you've basically been approved for Social Security disability and met the requirement to be eligible for Medicare. In the state of Colorado specifically, we provide a 6-month window of guarantee issue to people under 65, as long as you enroll in a supplement within 6 months of getting Medicare. Outside of that 6-month window, it would be very, very difficult for you to purchase this kind of coverage based on the fact that you are on Social Security disability. And even if you enroll during the 6-month window, keep in mind that you will typically pay higher premiums for this kind of coverage because they can assume that there are medical concerns because you are on Social Security disability. However, on the plus side, if you enroll in this kind of coverage under 65 or not, when you turn 65, you would have another opportunity and another 6-month window of guarantee issue to get this kind of coverage at a lower price when you do turn 65. Not every state in the country provides this guarantee to people under 65, but specifically Colorado does. Otherwise, there is no annual enrollment period for this kind of coverage. This kind of coverage is available for purchase at any time for any reason. But again, outside of that 6-month window of guarantee issue, you are subject to underwriting by any of the companies that you want to purchase coverage from. And again, if there are pre-existing health concerns and the company looks at your medical history and they do not like what they see, they will not sell you coverage. So ultimately, the best time to buy this kind of coverage is during that that 6-month window of guarantee, additional opportunities to be able to buy this kind of coverage. So
Roma, can you hear me? Roma, can you hear me? You keep freezing up. Jesse, are you aware of this? Is there something that can be done?
Yeah, he's probably stepped away. I
Can
think,
you're freezing up on us, Roma.
am I still freezing?
Go ahead and give it a shot.
All right, I'll just keep going, and if it happens again, I'll keep trying to log back on. Okay, so I think I was starting this slide. There are potentially other opportunities where you might have the ability to purchase this kind of coverage with guarantee issue. Those opportunities would be referred to as special enrollment periods. And special enrollment period opportunities will typically fall under involuntary loss of other types of creditable coverage. So for example, if you retired from an employer and that employer offered retirement health benefits that coordinated with Medicare, and you took advantage of those benefits, you did not need to purchase any kind of coverage in addition to that. So you had Medicare, you had your retirement health benefits through the employer, but at some point down the road, the employer decides to drop those benefits for retirees. That would be considered involuntary loss of coverage. And that would allow you a special enrollment period to have guarantee issue into a Medicare supplement, meaning they would not be able to underwrite you. Involuntary loss of coverage of any kind will typically provide you with that kind of opportunity. Another common way someone might be able to get a special enrollment period into a Medicare supplement would be through having enrolled in an Advantage plan when you became eligible for Medicare. But we're going to talk about that in more detail when we get to the next set of slides. As with all things Medicare, there are some things that Medicare supplements will not cover. And typically those are going to be the exact same things that Medicare does not cover. So again, Medicare covers all medically necessary needs and services. Supplements are designed only to pay after Medicare has paid first. So if Medicare does not pay for a service, the supplement will not pay for it either. It only picks up the balance. It does not cover things that Medicare denied or does not pay for. That includes long-term care, dental and vision, of course, hearing aids, outpatient prescription drugs, everything that A and B does not pay for, the supplement does not pay for either. In the email I sent out prior to this presentation, I did include a couple of handouts regarding Medicare supplements. One of the handouts is put together by the Division of Insurance up in Denver. This handout is a list of all the companies licensed to sell this kind of coverage in the state of Colorado. It says September of 2021, but this is the most current document available. And it won't be updated again until midsummer of 2022. Again, this lists all the companies licensed to sell this kind of coverage. It gives you the company's name and contact information. It tells you which levels of coverage each company sells, and it gives you an approximate in the ballpark premium estimate for each plan with each company. The other handout I included was this chart. This chart outlines and details the different levels of coverage available to purchase as a Medicare supplement. So based on the level of coverage you choose to purchase, will determine what your cost may be with any company for that level of coverage. So the second half of that first handout goes into these charts where it lists all the companies alphabetically, has the plan levels listed across the top. And if you intersect the plan level with a company, if there is a number where those two intersect, that does represent an approximate monthly premium for that plan with that company. So this gives you an idea of what this kind of coverage would cost with any of the companies that sells it. If anybody wanted additional information or counseling on this kind of coverage or about this option, you would be more than welcome to contact our office, and we'd be happy to sit down and talk to you about that. The other option that people can choose to access when they have Medicare is by enrolling in a Medicare Advantage plan. So this is option number 2. Medicare Advantage plans are an entirely different animal of insurance. So when you enroll in a Medicare Advantage plan, what you're enrolling in as a private plan through a private insurance company, but that private insurance company has contracted directly with Medicare to act on Medicare's behalf. So when you enroll in a Medicare Advantage plan, you're actually enrolling in a plan that is going to act as Medicare for you. Medicare is going to pay that plan to provide all Medicare covered services to you through the plan, not through Medicare directly. You still have original Medicare when you enroll in an Advantage plan, but that original Medicare benefit moves to the background. And that Advantage plan manages all your Medicare services and benefits, and you have to receive them through that plan. That's why this kind of coverage is sometimes referred to as replacement coverage, because it becomes your primary Medicare benefits. But again, you still have original Medicare, it's just moved to the background. And so you still have all your rights and protections of original Medicare. All services that original Medicare covers have to be covered under an Advantage plan. But these are called Advantage plans for a reason, and that's because they can provide some additional benefits above and beyond what original Medicare offers, such as routine vision, some hearing services, some limited dental, those kinds of things. Most Advantage plans, especially in our area, do include prescription drug coverage or the Medicare Part D benefit at no extra cost. Medicare Supplements, Medigaps, do not include Part D. So if you go with original Medicare and a Medigap, you would have to purchase a Part D drug benefit in addition to those in order to have drug coverage. Additional eligibility requirements to enroll in an Advantage plan: you must live in the plan service area that you purchase or enroll in. And basically what that means is you must purchase a plan that's available for sale in the county you reside in. The county you reside in is going to be your service area or network area. Again, you must be enrolled in both A and B of Medicare. And there are certain enrollment periods that you must take advantage of to enroll in this kind of coverage. It is not available year-round. So again, there are some enrollment periods you need to be aware of to enroll in an Advantage plan and a Part D plan. The initial enrollment period, which we've talked about, which is your initial opportunity to enroll in Medicare A and B, that 7-month window surrounding your 65th birthday. Additional enrollment periods to be aware of for Advantage plans and drug plans is the annual election period, which we typically refer to simply as open enrollment. There's the newest enrollment period available, which is the annual Medicare Advantage plan open enrollment period. And then there are, as always, special enrollment period opportunities. The initial annual election period, or what we call open enrollment, happens every fall between October 15th and December 7th. During this October 15th through December 7th opportunity, you have a chance to get into, get out of, or switch from one Advantage plan or Part D plan to a different Advantage plan or Part D plan. Any changes you make during this October 15th through December 7 window go into effect automatically January 1st. This happens every year. The newest enrollment period is specific for people enrolled in Advantage plans. So anybody who is actually enrolled in an Advantage plan as of January 1st of any year gets an additional 3-month window, January 1st through March 31st. And during that additional 3-month window, you have an opportunity to either get out of the Advantage plan you're enrolled in and go back to original Medicare with a Part D, or you can switch to a different Advantage plan. If you are not enrolled in an Advantage plan as of January 1st, this enrollment period does not apply to you. And then the special enrollment periods apply to special situations. Again, typically a special enrollment period under any circumstance of Medicare is usually going to involve involuntary loss of other coverage. The most common way someone can get a special enrollment period when they have an Advantage plan is if you move. Again, you have to purchase an Advantage plan that's available for sale in the county you live in. If you move out of that county, you cannot take your Advantage plan with you. In that scenario, Medicare considers that involuntary loss because it's not your fault. You can't take the plan with you when you move. What that means is when you get to where you're going, you can either enroll in an Advantage plan available in the county you move to, or you would have a small window of guarantee issue into a Medicare supplement in that situation. The other way you can get a special enrollment period is by a test drive with Advantage plans. So if you are becoming eligible for Medicare by turning 65 and you enroll in an Advantage plan when you enroll in Medicare at 65, Medicare gives you a 12-month window to test drive that Advantage plan. If at any point during that first 12 months you decide you don't like Advantage plans and you want to get out of it, you would be allowed to get out of that Advantage plan and still have guarantee issue into a Medicare supplement. That only applies to people who enroll in the Advantage plan when they first get Medicare at age 65. The other way you can use a test drive is if when you first get Medicare, you enroll in a Medicare supplement or Medigap, and you maintain that coverage for however long, 1 year, 2 years, 10 years. And at some point in the future, you decide you want to try an Advantage plan. So you drop your Medicare supplement, you enroll in an Advantage plan during the annual enrollment period. You get 12 months to test it out. If you decide it's not for you, you don't like it, you're guaranteed back into the supplement you dropped whenever you decide to drop that Advantage plan. It only guarantees you back into the supplement you dropped. And again, you have to maintain that supplement coverage without any breaks in that coverage up until the point you decide to test drive that Advantage plan. Again, all of those fall under special enrollment periods that give you an opportunity to get out of that Advantage plan. Again, Advantage plans work completely differently than an original Medicare with a Medicare supplement. Although they do still have to provide you any and all services Medicare pays for, they must be covered through the plan. Most plans will include drug coverage at no extra cost, so you wouldn't have to buy a separate Part D. But with Advantage plans, again, you're limited to buying a plan within your county of residence, and that's because these plans will typically have networks of providers and facilities that you have to use to get services. So most plans will include a list of doctors and providers that you are required to use while you're enrolled in that plan. And typically you're required to use that service network in the county you live in. With the exception of medical emergencies, you can be anywhere in the country. If you experience a medical emergency, the plan will pay for that. But the way the benefits and the costs are distributed significantly different than original Medicare with a supplement. There are many different kinds of Advantage plans to choose from, including HMOs, PPOs, private fee-for-service plans, special needs plans, and PACE programs. Colorado currently does not have any Medicare savings account companies in Colorado, and we don't currently have any demonstration or pilot programs. But if you are interested in getting a complete list of the plans available in Colorado, and specifically to which areas of Colorado, again, you can go to the Medicare New Handbook. If you call 1-800-Medicare and request a paperback copy of that book mailed to you, it will be specific for Colorado, and it will list all of the Advantage plans available, including the types of plans available in each area, some typical costs through those plans, etc. Each one of these types of Advantage plans does work slightly differently from the other. But the bottom line is you will typically pay a much lower premium for these kinds of plans. In exchange for that premium, that lower or no premium, you will usually have to pay a copay every time you receive a medical service. With Medicare Supplements, you pay a higher monthly premium, but typically you pay nothing out of pocket when you receive services. So with Advantage plans, you will have copays for most services, but you will have lower or no monthly premium in addition to your Medicare. I did include a handout in the email I sent earlier that goes into in-depth explanation of the different types of Advantage plans, as well as the pros and cons of each type of Advantage plan. I also included a handout that we put together at our office specific to El Paso County only, unfortunately, that says, that tells you all of the Advantage plans that are available in El Paso County, what kind of plan it is, whether or not there's a premium, copay amounts for typical services, all of that kind of good information. It's kind of a at a glance side-by-side comparison of the plans available in this area for 2022. So hopefully people will find that helpful versus asking for the Medicare New Handbook. I do have a quick question in the chat box. Do most doctors accept Medicare Advantage? The answer is maybe. The key to Medicare Advantage plans is the plans themselves have to contract with local doctors. So that contract says that doctor will accept patients in a particular Advantage plan. But there are a lot of Advantage plans to choose from. In Colorado, in El Paso County, just in El Paso County, there are almost 50 different plans to choose from. However, that's multiple plans offered by just a handful of companies. So if a doctor accepts one Advantage plan, that does not mean they accept all Advantage plans. If a doctor accepts all Advantage plans, that does not necessarily mean they accept Original Medicare. So it can become very important, especially if you have doctors you want to keep when you get Medicare, to ask that provider specifically if they take Medicare, Original Medicare, and or if they take any Advantage plans, and specifically which ones. Because there could be providers that take an Advantage plan from, say, AARP. AARP offers like 6 or 7 different Advantage plans in this area alone. They may take one of those Advantage plans, but not the others. So you would have to be very specific in asking which Advantage plan any particular provider accepts. So it's kind of a loaded question. I know some of the bigger doctor provider networks do take Advantage plans and will take most of them, but even that provider network does not take all of them. So it is important to ask your providers directly. If you don't have providers that you're currently trying to keep, you would have that plan, any particular plans network of providers to choose from once you're enrolled in a plan. So once you're enrolled in an Advantage plan, you do have rights based on Medicare rules and regulations. So you have right to access any kind of healthcare provider you need. You have the right to know how these doctors get paid. You always have the right to fast, fair, and efficient and timely appeal processes, and even expedited appeal processes in some settings. You always have the right to get the healthcare services you need. You have the right to receive information about your plan and your coverage in easy to understand language. And of course, you have the right to have all of your personal health information kept private. There are some do's and don'ts about how these plans can be marketed to beneficiaries. Unfortunately, when these plans became very popular a few years ago and exploded onto the market, suddenly we went from 10 Advantage plans to 50 Advantage plans overnight, it seemed like. When that happened, unfortunately, there were a lot of insurance agents out there that weren't as well trained as they should have been. And there were a lot of practices for selling people this kind of coverage that were not necessarily above board. So Medicare has come up with a bunch of things that agents and brokers who are trying to market these policies to you are and are not allowed to do. So I've created some slides that list these practices of what can and cannot be done, just so that you're aware. And if you happen to witness or receive any of these cannot do activities, it is greatly appreciated that you report that, if not to the Division of Insurance, to our office here locally, and we'll help get that resolved. So lots of things that agents and brokers are not allowed to do when marketing this kind of coverage to you. If they have a table set up somewhere in a public forum, they can do that, but they're not allowed to start walking up to people who are in that public setting and talking to them about insurance. If someone walks up to their table for information, they're allowed to talk to them. They're not allowed to send unsolicited texts or make unsolicited calls. But as with most advertisers, they can send junk mail or emails with an opt-out option. And of course, you can always get junk mail in the snail mail. They're not allowed to refer to anything that they sell as free, even if it's a $0 premium. They cannot require that someone sign in if you're there to attend a marketing or educational event they're putting on. They're not allowed to have tables set up in doctor's offices or lobbies. They can conduct marketing events. I'm sorry? Thought that was a question. They can conduct marketing events immediately following educational events. They cannot provide meals. So you cannot get a postcard that says, we'll buy you dinner at, King's Table if you come and listen to our spiel. They can't do that. They cannot go door to door. They cannot even put flyers door to door. They are not allowed to do that. All materials that they do provide for marketing purposes have to be approved by Medicare. They are required to comply with do not call registries. And even if you contact them and schedule an appointment to talk to them about what they're selling, when you have that appointment, they are required to have you sign what's called a scope of appointment. And what that means is that they're limited to talking to you during that appointment about the specific product you inquired about. They're not allowed to talk to you about other insurance or financial products during that appointment. Again, included a handout in the email I sent that provides a little more information about the do's and don'ts and just the different things you should know. So if you are looking at this kind of coverage, and it can be very attractive because it does have many plans with 0 monthly premium in addition to Medicare or very low monthly premiums. And I'm sure everybody has seen the commercials on TV for this kind of coverage. Things that you want to ask yourself before you sign on the dotted line. Again, because most of these plans include drug coverage, you want to make sure that the plan you're looking at enrolling in covers your specific drugs. If, like I mentioned before, if you have doctors you want to keep, you absolutely want to make sure that those doctors take any of the Advantage plans you're looking at. If you see a lot of specialists, make sure that you understand whether or not the plan that you're looking at is going to require that you get a referral from your primary doctor every time you want to see a specialist, because not only will that delay that service, but it may cost you an extra copay and those kinds of things. Just be sure to ask lots of questions when you are looking at Advantage plans and make sure you get lots of answers. Additional handouts I included. This is the one I mentioned a minute ago that gives you much more detail about the different types of Advantage plans and the pros and cons of each. And this is the handout that is put together by our office, kind of that side-by-side comparison that lists all the specific plans available in El Paso County. I know we're running over time, but I'm trying to get through Part D here real quick. Medicare Part D is the newest benefit of Medicare. It is the prescription drug coverage for Medicare. This benefit went into effect in 2006. Prior to that, people had to pay for their medications out of pocket. The Medicare Part D benefit of Medicare is for pharmacy drugs, outpatient drugs, medications that you get a script from the doctor, you take it to the pharmacy gives you the meds. That's all the kinds of drugs that it covers. There are lots of different Part D plans to choose from several different companies. Every one of those different plans will have a different formulary or list of drugs that that plan covers. But Medicare does require that every plan include a minimum level or minimum number of drugs and categories. If you buy a Part D plan by itself, because it's not included in your Advantage plan at no extra cost, you will pay a monthly premium. All Part D benefits, whether it's through an Advantage plan or you purchase it separately, will typically have a deductible, and you will always pay copays at the pharmacy. And there is potentially some financial assistance available to help with some of those costs if you have limited or low income. Part D plans, just like with any other part of Medicare, are optional to enroll in. However, as with other parts of Medicare, if you don't enroll when you first become eligible and you didn't have a good excuse for not enrolling, such as having other drug coverage, when you enroll down the road, if you enroll down the road, you will be penalized. A late enrollment penalty will be assessed. Once it's assessed, it's tacked onto your monthly premium forever. However, if you have other creditable coverage that allows you not to have to purchase a Part D, for example, if you have coverage through a retirement benefit, if you use the VA pharmacy, that is considered credible coverage. You would not have to purchase a Part D. If you're actively employed and your employer group health plan includes drug coverage, the employer is required to tell you every year whether or not that benefit is considered credible compared to Part D. Again, as long as you have other credible coverage, you would not need to enroll in a Part D at this time. In order to be eligible to enroll in a Part D, you only have to be enrolled in Medicare A or B, or both. You don't have to be enrolled in A and B. TRICARE for Life is considered creditable coverage. You would not need a Part D. The penalty for Part D late enrollment without other creditable coverage is calculated a little bit differently. It is calculated at 1% per month for every month you did not have creditable coverage and were not enrolled in a Part D. And when you do enroll down the road, they're going to take the number of months times 1%. They're going to multiply that times the annual Part D national average premium, which for 2022, I forgot to change the year, is $33 and change. Whatever that comes out to will be tacked on top of the monthly premium you pay for Part D forever and ever and ever and ever, because again, penalties never go away. Part D premiums are also means tested, just like Part B premiums, meaning the higher annual income you have, the higher potential Part D premium you will have to pay above and beyond what the premiums for everybody else would be. Same income thresholds, $91,000 or higher for a single person, and so on. And it does list the additional amount you would pay for Part D on top of a Part D premium. And again, they're going to base that on the most complete IRS tax filing they can access, which will likely be from 2020. Can you get a Medigap policy for Part D? You cannot. So there is no plan or policy you can purchase that would cover your deductibles and copays at the pharmacy. Part D plans require that you pay, well, you don't always have to pay deductibles. Some plans will cover that for you, but you always have to pay copays. There is nothing that helps cover those costs.
Roma, did you see the question on the one before that? I have a friend who has been diagnosed with.
I did not. I do not see that question. Do you have that question?
I have a friend who has been diagnosed with colorectal cancer. I'm not saying that right, forgive me, and was dropped from his insurance. Is there anything he can do about that?
Well, A, he shouldn't have been dropped from his insurance because he got sick. So that would be a complaint to the Division of Insurance. B, it would depend on whether or not that person was Medicare or not, as to what the options might be. Certainly that is something we'd be happy to talk to you about one-on-one. And so you're more than welcome to shoot me an email or give us a call at the office tomorrow, and we're happy to look at that a little more closely and see what we can help direction you could go in.
Okay, great, thank you.
Okay, so Part D plans are outlined, indicating that there will be an annual deductible for 2022. That deductible for this year is $480. Once that deductible is met, your copays go down to 25% of retail. So you pay 25%, the plan pays the other 75% until you reach a certain dollar amount in total costs, $4,330. At that point, you would hit what they call the coverage gap, used to be known as the donut hole. In the donut hole, you will continue to pay 25% of retail for both brand name and generic drugs until you hit the other side of the donut hole, which means your total costs accumulate to $10,000. If you hit the $10,000 mark in total drug costs for the year, you hit catastrophic coverage, where your copays at the pharmacy for the rest of the year go down to 5% or less, or flat copays. All of this is based on retail cost and how the drugs structure their copays. So even though during that initial coverage zone, it says you pay 25% as a copay, many of the plans will provide better coverage than that. And they may provide zero copay generic or $1 or $2 copay generic. They may offer a $20 copay for a brand name drug versus 25%. But if you hit that coverage gap, those $0 copays or that $20 brand name copay would jump up to 25% copay. And it's the full retail cost that gets you to that coverage gap. And then they continue to add costs up, but only the 25% once you reach the coverage gap. All of this would have to happen within a calendar year. And then January 1st, everything resets. So the deductible resets and what have you, all the costs increase a little bit every year. Again, all Part D plans have to meet minimum coverage requirements by Medicare. And what that means is Medicare requires every plan to cover at least 2 medications in every medical class of medication. So for example, if there are 20 different kinds of high cholesterol medication on the market, each plan has to cover at least 2. They can choose to cover more than 2, but as long as they cover a minimum of 2, they're meeting the Medicare guidelines. There are the 6 classes listed on this slide, where if there are any products on the market under those 6 classes of medication, every plan must cover every product available. But for all other medical classes, they only have to cover the 2. What that means is every Part D plan, whether it's a standalone just drug coverage plan that you pay a premium for, or whether it's included as part of your Advantage plan at no extra cost, every single plan available is going to have a slightly different list of drugs that it covers based on those minimum requirements. Every plan will have different copays for the drugs that they cover. So they'll have a different list of drugs, they'll have different copays for those drugs. So it is very important to make sure that whatever plan you're thinking of enrolling in very specifically covers the drugs that you take, preferably at the lowest price. Medicare also requires that drug plans cover only drugs that are provided by prescription. So they must require a prescription, and they've been approved for use by the FDA. So it has to be approved by the FDA, has to be by prescription to be covered under Part D. Does include drugs, biologicals, and insulins, and the supplies for injecting insulin. And every plan must include both brand name and generic drugs on their formulary. As with all parts of Medicare, there are some things that Part D does not pay for. If a drug was covered while you were in the hospital, or if it's covered while you're in the doctor's office, it is not Part D. If it's considered over the counter, does not require a prescription, it will not be covered by your Part D. Even if it requires a prescription, if it's specifically to treat anorexia or for fertility purposes or cosmetic only purposes, it would not be covered by Part D. Even if it requires a prescription, if it is solely and specifically used to treat cough and cold symptoms, it's not going to be covered by Part D. Robitussin is a perfect example of that. And most vitamin and mineral supplements will not be covered by Part D. With some exception, there are some vitamins and minerals that may require a prescription to treat very specific diseases or conditions that would be covered under Part D. Again, I mentioned there could be some financial assistance available for people who have lower limited income to help with some of the Part D costs, such as premiums, deductibles, and copays. Income limits for this assistance is higher than the income limits for help with Part B that we discussed earlier. Help for Part D is applied directly through Social Security. So you can do that by calling 1-800-SOCIAL-SECURITY. You can do that online at the Social Security website. Again, income and asset limits are higher for this assistance, so more people should qualify for help with their drug coverage than with help with their Medicare Part B premium. Anybody who wants more information or would like assistance in applying for this kind of coverage, please give us a call. We're happy to help with those applications and eligibility determinations. If you don't qualify for that assistance, but you're still struggling to pay for some of the medication copays, there could also be some assistance available through patient assistance programs. These are programs that each drug manufacturer offers. Again, it's going to be based on income and asset levels, but through patient assistance programs, those levels tend to be much, much higher than through the government programs. Typically, you might be required to have reached your coverage gap, or you have to prove that you have spent a certain percentage of your household income on drug costs to qualify for these programs. But for many people in that situation, that's not difficult to do. We've also listed some of the websites that you can go to find patient assistance programs for any specific medications. Typically, patient assistance programs are going to apply to brand name drugs and not generic drugs. So if you're taking an expensive brand name drug and it's becoming difficult to pay for, even with Part D coverage, you can go to these sites and see if your drug has a patient assistance program. You're also welcome to call our office and we can help you find that information as well. Again, I mentioned that you can create your own account on Medicare's website. This personalized account will be able to save your list of medications and your pharmacy preferences. It is also going to be useful for finding the most cost-effective Part D plan available. Because there are so many plans to choose from, whether it's a standalone Part D or an Advantage plan, it is almost impossible to call each plan and ask them if they cover all of your meds and whether or not that plan is going to save you the most money for that coverage. Fortunately, Medicare has found a solution to this. When Part D went into effect in 2006, it came with a search engine on the Medicare website. This search engine is specifically for people to find the most cost-effective Advantage plan or most cost-effective drug plan specific to the medications they take. So by using the search engine, you put in all of your specific medications, your pharmacy preferences, and the end result is the search engine will tell you which plans cover all your medications for the lowest price overall. It is a wonderful tool. It is the most effective tool when looking at what plans to enroll in, because you can talk to agents all day long. They're going to tell you what the costs are for the plans that they sell, but that's not going to tell you if that's the most cost-effective plan you can have. This search engine gives you that information. You can access it directly from the Medicare.gov homepage. I've circled in red how to access that search engine from that homepage. You can go one of two ways. Once you click one of those options, you can either create that personalized Medicare account, or you can continue to look for that information without creating an account. So you don't have to create an account to use this search engine. And I've circled where you can find that link to not have to create an account. Again, this is the most effective way to find a drug plan that's going to save you the most money, or an advantage plan that's going to save you the most money. It provides a lot of good information about the specific costs for your specific medications for all of these options. We are happy to help somebody with this search process, or we're happy to help walk you through the search process so that you're confident that you're doing it properly and getting the correct information. Again, simply give us a call. We're happy to walk you through that or schedule an appointment to go over that information with you. Medicare resources, again, going to be the Medicare New Handbook that you can either go to the website and download as a PDF, or you can call 1-800-Medicare and request that they mail one to you. The Medicare.gov website, again, is going to have lots of good information, or you can call Medicare. Medicare is available by phone 24 hours a day, 7 days a week, 365 days a year. But that is the only way you can contact them, because there are no brick and mortar locations for Medicare itself. Or you're always welcome to call us, your local SHIP office. This is what we do. And we are paid by the government to be Medicare experts and be able to help you understand all of these options in more detail and go over all the specifics of your individual situation to help you determine what options work best and most effectively for you. Again, our office here in Colorado Springs serves 9 counties of Colorado. You can call us either at our local Colorado Springs number, or you can call us by the toll-free statewide number. You can send us an email. I'm happy to respond by email. We are scheduling in-person appointments, but it's by appointment only, or we can do a Zoom appointment, or we can simply talk over the phone, whatever works best for you. And I know we went way over time, but I do appreciate your patience tonight. Hopefully this was helpful information. Again, if you have any questions or you would like to schedule an appointment, we're happy to do that with you. Simply give us a call or shoot us an email, and we are available for whatever you may need. And with that, I will ask one last time if there are any other questions I can help address, and then I will let you all go for the evening.
Make sure you all fill the survey out that will be coming out tomorrow, folks. That'll be coming out in tomorrow's email, and that's how you register for the door prize with END. And we hope that you will attend the next 3 sessions that we have scheduled. We have Meaning and Purpose next Monday. We have Estate Planning on May 9th. And we have Social Security 101 on May 16th. So we hope you can enjoy us or be with us and enjoy the presentations. Thank you for your patience in the presentation this evening. I knew there was a lot of information. That's why we wanted to get going right away. So thank you for hanging in there with us.
Absolutely. And please let us know if there's anything else we can help you with, or if there's any other information you would like, or if you would like to schedule an appointment or simply have a conversation with us one-on-one, just give us a call.
And with that, folks, we're going to call it an evening. Thank you so much. We hope to see you next week. Don't forget about the survey.
Have a good
Bye-bye.
night.
Yeah.